Good afternoon, dear doctors. So today I'm talking about some of the OSCE from radiological diagnostic. So let's start. So first, how you answer this type of OSCE? There will be some questions which will be attached there. They may ask, describe the findings, what are the differential diagnosis, what is the most probable diagnosis, some clinical features, management, like that, a typical finding like that. So whatever question is asked, you read that question carefully and then try to answer. Okay, now let's start. The first question is here. This is the CT scan of the head which is provided here. You can clearly see the first CT is here. The history will also be provided to you. Probably there is a history of fall in an older age patient, and they may present with headache, vomiting. There's a projectile type of vomiting with the features of raised ICP. Okay, and the CT scan will show typical finding. Now what is this typical finding here? This is a crescentic shape. Okay, crescentic shape of the bleeding. And another important thing is it is also known as concavo-convex appearance in the CT. So this is an acute subdural hemorrhage. Okay, if you come across a case like this, this is called acute subdural hemorrhage. And the second one which you see here is a subacute to chronic hemorrhage, especially subacute type, because some of the areas are hypodense. Now this is a hypodense area in the CT scan, and this is a hyperdense area. So there is a combination of different areas there. Okay, so this is most probably the subacute type of subdural hemorrhage. Now another finding which is shown here is a midline shift. This is a midline shift as well. Okay, so some of the related questions they will ask you here now is like, what may the cause of subdural hemorrhage? Subdural hemorrhage is usually caused by rupture of the bridging vein. Okay, the cause is rupture of the bridging veins. Okay, this is the important one. Sometimes it may be caused by bleeding disorder as well, bleeding disorders like thrombocytopenia. So these are the questions which they commonly love to ask. Okay, let's move further. Now, another one is the CT scan again, which is showing this typical finding. Now look at this finding here. This is biconvex. Okay, biconvex in shape. In other words, it is lemon shape. Okay, lemon shape hemorrhage. And sometimes they may provide you a typical clinical scenario. The patient had a history of trauma, probably while playing the cricket, or road traffic accident, or fall from a height, anything like that. And in the beginning the patient became unconscious. He again regained the consciousness, and then later on again became unconscious. So this is lucid interval. So they may provide you the features of lucid interval and with this typical CT scan. So this is a case of extradural hemorrhage. Okay, extradural hemorrhage. Okay, so what are the points here? And to repeat it again, there is the biconvex shape of hemorrhage. It's a lemon shape, it is also called. There is a typical history of lucid interval. This is called extradural hemorrhage. So this is the diagnosis. And this is the acute bleeding which is present in the extradural space, and this occurs because of the rupture of middle meningeal artery. And this middle meningeal artery is the branch of external carotid artery, and it is usually associated with fracture of the temporal bone. Okay, these are some other findings. Now treatment of this case will be, it depends on the posture of the patient. If the patient is having posturing like decortical or decerebrate posture, then burr surgery has to be done. Okay, so these are some of the important points. Let's move further. Look at the number 3. So look at the CT scan very carefully and describe the findings here. The findings would be all ventricles are dilated. Okay, this is lateral ventricle, third ventricle and fourth ventricle, all are dilated here. Okay, so that is the first thing, all ventricles are dilated. Okay, second, what is the diagnosis now? If all ventricles are dilated, most probably it is a case of communicating hydrocephalus. Okay, and what is the probable cause? Remember, communicating hydrocephalus usually caused by problem in the blockage site, problem in the drainage site of the CSF. Okay, means there is block at the drainage site. So where is the drainage site for CSF? Okay, very easy question. That is arachnoid villi and arachnoid granulation, and through there the CSF will drain into the superior sagittal sinus. Okay, superior sagittal sinus. So these are some of the very important points. Now this blockage in the drainage site is mainly caused by subarachnoid hemorrhage and meningitis. Usually bacterial or tubercular meningitis. So these are some associated or related questions. Let's move on. Number 4. Okay, again there's a CT scan of the brain. So find out the important findings here. Now look at the findings here. This is fourth ventricle. The fourth ventricle is collapsed. It is smaller than the normal. This is the lateral ventricle. Okay, lateral ventricles, both of these, and this is again lateral, and this is the lateral ventricle again, and this is the third ventricle. Third ventricle. Now you can clearly see actually third ventricle is dilated, lateral ventricles are dilated, and only fourth ventricle is collapsed, so it's very small. So this is a clear-cut case of obstructive hydrocephalus. Or you can say non-communicating hydrocephalus, because there is an obstruction of the blockage between the ventricles and the subarachnoid space. And where is the block? Now that's the question. Okay, where is the block? Because fourth ventricle is collapsed and all other ventricles are dilated, so the block has to be at cerebral aqueduct. Okay, it is a site for blockage. It's absolutely easy. Now let's go to the another one. Okay, so this is another case which is again showing the CT scan and describe the finding. The finding is here in the aorta area. You can see the hypodense area here, the hypodense area. Okay, hypodense area in the CT. And if they ask you a differential diagnosis, one of the important differential diagnosis here is cerebral infarction. If they give you a typical case of stroke or paralysis of one half of the body, then it is a case of cerebral infarction. Another maybe some other type of condition like brain abscess. If there is a plain CT, and this is plain CT, the brain abscess can be another thing, and some inflammation and things like that can also present like this. Okay, but usually it is a case of cerebral infarction. So what is the clinical findings in this patient? If they ask you this question, then you can say one half of the body may be paralyzed. That is actually the opposite half of the body will be paralyzed. Okay, good. Let us move further. Number 6. So this is another CT scan. So it is showing there is hyperdense area in the basal ganglia. This is hyperdense area, and this is another hyperdense area. Okay, hyperdense area. Fine. So if hyperdense area occurring in the basal ganglia and dentate nucleus, then it is called intracerebral hemorrhage. or it is also known as intracerebellar hemorrhage. You know, dentate nucleus is present inside the cerebellum. Okay, so intracerebellar hemorrhage, because the acute bleeding or blood looks white on the CT. It is called hyperdense lesion. So this is a very typical finding. If they ask you the clinical feature of this particular condition, you can say increase ICP, raise ICP, which leads to headache, projectile vomiting, seizure, loss of the consciousness, all those type of feature you can say here. Good. Let me move further. Number 7. Okay, again the question is describe the findings and what is the probable diagnosis. You can see a lesion, okay, on the extra-axial area, usually extra-axial area of the cranium, and it is going inside from the outside area, you know, and it is also causing the midline shift. So most probably you know, this type of condition is extra-axial tumor, and one of the commonest type of extra-axial tumor in the cranium is called meningioma. Okay, now a little bit of information. Meningioma has the presence of psammoma body. Okay, psammoma bodies are the areas of calcifications inside the meningioma. This is an important question which they ask. Another one, okay, describe the findings again, and what are the probable diagnosis and differential diagnosis. These findings would be, it is called ring enhancing lesion, okay, and this is contrast enhanced CT scan. So contrast enhanced CT scan shows ring enhancing lesion. So the differential diagnosis of ring enhancing lesion would be, okay, so see there, differential diagnosis of the ring enhancing lesion. Okay, one is brain tumor, second is called brain abscess, third is neurocystic sarcosis, fourth is hematoma, okay, and fifth maybe, you know, some other conditions which can result in mass lesion inside the brain, like tuberculoma, you can say, and another may be AV malformation. So any of the mass lesion inside the brain may result in this ring enhancing lesion. Okay, so this is important point. Now what it can be, probably this mass has ruptured and there is a collection of material inside the ventricle. So this is ventricle, so collection of the materials inside the ventricle. So probably this is a case of brain abscess. So you can answer like this. Okay, and if they ask you what is the treatment of brain abscess, the treatment is very simple. Wherever the abscess occurs, the treatment is incision and drainage or aspiration. Then along with that, antibiotics. Okay, so one more case. Okay, and I'll continue in my, you know, another session. Now look at the, you know, X-ray here and describe the findings. Now you can clearly see there are double ureter there. Okay, double ureters. So this is a case of double ureter. Okay, so let me stop here today. So we'll see you again next time. Thank you.